everyone. Today I will be looking at health financial system of Trinidad and Tobago. Before we venture further, I will just give a brief overview of the country. Trinidad and Tobago is the southmost island country in the Caribbean and is known for its fossil fuel wealth. This English-speaking democratic state consists of two main islands, Trinidad and Tobago, and numerous smaller islands. It is situated between Grenada, Venezuela, and Barbados. Trinidad and Tobago changed hands during history among Spanish, British, French, Dutch, and Corelando more than any other island in the Caribbean, making their customs and traditions a diverse one. Trinidad and Tobago has the highest GDP per capita, based on the purchasing power parity in the Americas after the United States and Canada. It is recognized by the World Bank as one of the countries with a high income economy. Unlike other Caribbean countries, Trinidad economy has more emphasis on the energy sector than tourism, which accounts for approximately 40% of their GDP. Over the past 6 years, Trinidad has created the largest single sustained phase of economic growth. In order to study the health financing system of Trinidad and Tobago, we must first find their published health accounts and statistics report of the latest year that is available. For Trinidad and Tobago, this was the first of its kind. This was vital due to the increase or the rise in the chronic disease index along with an increase in HIV cases. The 2015 health accounts estimation or HA for Trinidad and Tobago was conducted using the System of Health Accounts 2011 framework. This was a crucial step in understanding health spending by aiding the alignment with the country's goal and priorities during the period of 2014 October and 2015 September, which was validated in 2018 and published. This paved the way to major financing reform. Despite the Trinidad and Tobago economy depends mostly on the energy sector, they have a two-tier universal care system where they get funding from both private and public sector. Although the government provides majority of the current health expenditure of 55% via the 5 areas of the regional health authorities through the Ministry of Health. Of the regional health authorities or RHA that manages the health funds, the Southwest RHA and the North Central RHA are the largest shareholders with 11% each, followed by Tobago RHA at 6%. Households are the second largest contributors via out-of-pocket spending at 44%. Contributions by donors, NGOs, and employers via insurance companies account for less than 1%, with the focus being on the chronic disease and HIV. Most other areas were at a huge disadvantage. This isn't much information when it comes to geriatric, oncological, or psychological care, which demonstrate that they are more selective about their healthcare system rather than comprehensive. Note that most of their out-of-pocket expenditure is followed up with overseas care, since the sector is in dire need of further development. Trinidad and Tobago have the National Insurance Board, or we would know it as NIBTT, where they execute a PAYE system, or pay-as-you-earn system, where persons who earn above the minimum wage of $200 per week is required to register and allow them to have a range of benefits. As of 2014 March, they implemented a new policy where persons earning below the threshold will still be able to register but have a lower access to health care. Private insurance companies would offer different premiums, including international health insurance, but it does not contribute exponentially to the finance system. The total health expenditure in Trinidad and Tobago during 2015 fiscal year is estimated to be $9,955,666 and $420. This is in TT. This is the international comparable figure of health spending used in completing the health accounts exercise. Of this spending, $9,073,090,936 TT represent recurrent expenditure, which is at 91%, and $882,575,484 TT represent capital expenditure at 9%. For the financial year of 2014-2015, the fund returned 2.5%, compared with gains of 1.1% for the Strategic Asset Allocation or SAA benchmark. The equity portion of the fund contributed approximately 1.0% to the total return, while the fixed income portion added 1.5% total return. The strongest performing mandate was the U.S. core equity mandate, which generated an absolute return of 3.5%. The U.S. core fixed income portfolio also posted a relative solid gain of 2.7% at the end of September 2015. The fund's net asset value stood at a whopping 5,655.1 million, up to $5,532.4 million. This is in US dollars, as at the end of September 2014. During the financial year, there were no contributions made to the fund. Due to Trinidad and Tobago's high dependency on the energy sector, they have fluctuated in revenue, which impact greatly on how health government fiscal balance will be. From the fiscal year of 2009-2016, the country ran a fiscal deficit that can be attributed mainly to a continuous increase in the public sector debt, from 32.1% of GDP in the year 2010 to 58.8% GDP in 2016. According to the Central Bank of Trinidad and Tobago, CBTT, and Data Center, following the 2008 global financial crisis, Trinidad and Tobago economy experienced a decline in real growth from 3.4% in 2008 to a negative 4.4% in 2009. Despite some signs of recovery in 2010, the economic growth declines to a negative 0.3% in 2011. Due to the negative growth in the energy sector and expansion in the non-petroleum sector, particularly in finance, distribution, transport, construction, agriculture, boosted economic growth somewhat in 2010 to 2013. The country suffered another economic decline in 2014 to 2016. This portrays the country was in regressive state of health finance. In Trinidad and Tobago, the government scheme accounts for 55% of the recurrent expenditure. These funds are pooled resources with risk distribution across the population. Less than 1% was from health funds via insurance schemes and NGOs, and 44% were borne by households via out-of-pocket payments. These payments do not provide risk pooling across individuals, given that households are forced to bear the full brunt of health services in times of need. According to WHO in 2010, UP spending of more than 20% increases the likelihood of poverty. This indicates that the government of Trinidad and Tobago should address UP spending in order to achieve their sustainable development goals. The primary equity market has remained relatively inactive as companies have tended to use debt rather than equity financing. According to WHO, achieving UHC should consist of three criteria: raising health funds, fund pooling and prepayment without direct out-of-pocket payments, allocating funds that promotes efficiency and equity. In this regard, Trinidad and Tobago is unable to achieve such. So, there are a few recommendations that I would like to give, which is establish national risk pooling arrangement to reduce household UP spending to minimize risk of financial burden and potential catastrophe health expenditure. Decrease the high dependency on the other energy sector, that if this crashes, the economy crashes as well. Improve taxation system with better insurance policies so that there will be better access to health care. Improve government data availability for more detailed analysis of expenditure, since doing this assignment was very limited. Increase access to health services and allocate effective by spending more resources on preventative and primary health care facilities. Improve health information management systems to ensure better documentation and more detailed of an expenditure analysis. Monitor commitments to sustainable development goals and universal health coverage, and institutionalize health accounts exercising through ongoing and regular data collection. Analysis increase in ownership of data results in application. These are my reference. Thank you for watching.